Hello, I'm sorry I can't be there live, but I wanted to send you this message because I think today's workshop is very important. Millions of people are living with Alzheimer's today, and it affects millions of other people. Not only does it affect individuals living with Alzheimer's, but it also impacts their loved ones and those who care for them. While science continues to work to find treatments and cures, we need to learn how to approach life with Alzheimer's. Today's workshop covers one very important piece of that. If we can recognize the signs of Alzheimer's early on, it gives us more time to plan and more time to help our loved ones. For that reason, I'm happy that you're here, and I welcome you to this workshop. And I want to thank the Alzheimer's Association for sharing this information. I think you will find it very helpful. Thank you.
Hello, everyone, and thank you for joining us tonight for our Alzheimer's Awareness Workshop, and thank you, speaker, for the message. I just want to start off by saying there is Spanish translation. Buenas tardes a todos. Si gusta escuchar esta webinar en español, por favor seleccione el imagen abajo global que aparece en la pantalla inferior de su pantalla. Luego seleccione escuchar traducción en español y puede escuchar el programa en español. Okay. As a reminder for tonight, if you have any questions, please go ahead and write it down in the chat box for those of you joining us through our Zoom webinar. And we will be holding off questions until the end of the presentation. Now I'd like to introduce you to our presenter tonight, Janie Groman. Thank you for joining us tonight.
My pleasure. My name is Janie Grauman. I'm a licensed clinical social worker based here in Los Angeles. I have more than 25 years of working specifically in the field of geriatrics, which is issues affecting older adults. And I specialize in working with individuals and families who have dementia. So we are gonna start our presentation now and talk to you about the 10 warning signs of Alzheimer's disease. So here are our learning objectives for this presentation. We're going to describe typical age-related memory, thinking, or behavior changes. We'll recognize common warning signs of Alzheimer's and dementia. We're going to discuss the tips for approaching someone if you have concerns about memory changes that you see in yourself or someone else. We're going to explain the importance of early detection and benefits of diagnosis. We'll identify possible tests and assessments for the diagnostic process, and then name the resources available through the Alzheimer's Association. So let's meet the Garcias. Mary, a 73-year-old widow, lives alone. She's a retired teacher who has always meticulously cared for her home. Her daughter, Lydia, has recently been noticing laundry pileup and junk mail and old newspapers lying around the house. Yep, next screen. I'm worried about mom. She keeps losing things and the house is a mess. Probably normal to get a little forgetful at age. It's so unlike her. Should we worry? Let's reach out to our old neighbor, Dr. Soloway. No, go back please and play where the arrow is. Yeah, there's the video. Thank you.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
We'll talk much more about this through the presentation, but what Dr. Soloway said there really is the basis of this, which is things change for people, for all of us, over time. But when you start to notice changes that are patterns of behavior over time, not just a one-time bad day, and that starts to interfere with someone's ability to do what they used to do or to remain independent, that's a time when you may worry, is it Alzheimer's disease? Okay, next slide. So, first of all, let's talk about what is dementia, up at the top there.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual. But there is also some overlap in behaviors among the types of dementia.
Okay, so that's an overview of dementia. So what is Alzheimer's disease? Yep.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells, or neurons, throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So why is it important to know the signs?
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
Okay, next. So we're going to go through each one of these and talk about the 10 warning signs of Alzheimer's. Okay, number 1, please. Memory loss that disrupts daily life. So what are the possible signs of dementia? One of the most common signs of Alzheimer's is forgetting recently learned information. Others include forgetting important dates or events, asking the same questions over and over, increasingly relying on memory aids like reminder notes or family members for tasks formerly managed with ease. So what's a typical age-related change? It's sometimes forgetting names or appointments, but remembering them later. Next sign. Challenges in planning or solving problems. What are the possible signs of dementia? Some people may experience changes in their ability to develop and follow a plan or work with numbers, which may result in trouble following a familiar recipe or keeping track of monthly bills, difficulty concentrating and taking much longer to complete tasks. So what's a typical age-related change? Making occasional errors when managing finances or household bills. Let's watch the video that what was a sign for John.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking I was in my sleep, I was thinking about what I was anxious about, which was what I was trying to remember, which was what I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
Okay, next, please. Number 3, difficulty completing familiar tasks. What are possible signs of dementia? People living with dementia commonly have difficulty completing daily tasks such as driving to a familiar location, organizing a grocery list, remembering the rules of a favorite game. So what's a typical age-related change? Again, occasionally needing help to use the settings on a microwave or to record a television show. Let's hear from the expert.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
Next sign. Number 4, confusion with time or place, sometimes referred to as disorientation. What are possible signs of dementia? Excuse me. People living with Alzheimer's or other dementias can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it is not happening immediately, or forget where they are or how they got there. What's a typical age-related change? Getting confused about the day of the week, but figuring it out later. Next sign. Number 5, trouble understanding visual images and spatial relationships. What are possible signs of dementia? For some people, having vision problems is a sign of dementia, which may lead to difficulty with balance, trouble reading, problems judging distance and determining color or contrast, which may cause issues with driving. What's a typical age-related change? Vision changes related to cataracts or vision changes related to simply getting older. Let's hear from the expert.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Okay, next slide. Number 6, new problems with words in speaking or writing. What are possible signs of dementia? People living with Alzheimer's may have trouble following or joining a conversation. They may stop in the middle of a conversation and have no idea how to continue, repeat themselves, struggle with vocabulary, have trouble naming a familiar object or use the wrong name, as opposed to What's a typical age-related change? Sometimes having trouble finding the right word. So what was a sign for Phil?
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
Next sign. Number 7, misplacing things and losing the ability to retrace steps. What are possible signs of dementia? A person living with Alzheimer's may put things in unusual places. He or she may lose things and be unable to go back over their steps to find them, accuse others of stealing, which may occur more frequently over time. And what's a typical age-related change? Misplacing things from time to time and then retracing steps to find them. Let's hear from the expert.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space. So there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
Number 8, decreased or poor judgment. What are possible signs of dementia? People living with Alzheimer's may experience changes in judgment or decision-making. They may use poor judgment when dealing with money or pay less attention to grooming or keeping themselves clean, as opposed to what's a typical age-related change, making a bad decision or a mistake once in a while, like neglecting to change the oil in the car. So what was a sign for Teresa?
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Next sign. Number 9, withdrawal from work or social activities. What are possible signs of dementia? A person living with dementia may experience changes in the ability to hold or follow a conversation. As a result, he or she may withdraw from hobbies, social activities, or other engagements. They may have trouble keeping up with a favorite team or activity. So what's a typical age-related change? Sometimes feeling uninterested in family or social engagements. Let's hear from the expert.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
And the last one, number 10, changes in mood and personality. What are possible signs of dementia? People living with dementia may experience mood and personality changes, such as becoming confused, suspicious, depressed, fearful, or anxious, getting easily upset at home, with friends, or when out of their comfort zone. What's a typical age-related change? Developing very specific ways of doing things and then becoming irritable when a routine is disrupted. Let's hear from the expert.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
Okay, let's go to next. Interpreting signs and deciding next steps. Did you look at the warning signs info I sent? I did, but still don't know. Mom's showing a couple of signs, but not all the time. So how do we know if it's serious enough to see a doctor? Let's check back with Dr. Soloway.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
Correct. Okay, next. So 10 signs of Alzheimer's. Here's the recap. These 10 signs are a guide to identify problems that may be related to Alzheimer's. Individuals may experience one or multiple warning signs in varying degrees, but they don't have to experience them all for there to be concern. If you notice any of these signs in yourself or someone else, it's important to see a doctor. Okay, next. We're going to talk about the importance of early detection. Next. Friends and family are often the first to notice changes. Let's hear from the expert.
It's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
And what did Mary notice?
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
Next. So, what should you do if you notice changes in someone? Next. So, we're going to talk about 10 steps to approach memory concerns, from assessing the situation to seeing a doctor. So, let's go to number 1. What changes in memory, thinking, or behavior do you see? Get specific. Make a list. If it's over time, you're noticing certain things, write it down. This is obviously if you are noticing it in someone else. If you notice changes in yourself, it's a little harder to do, but you want to get specific. Next. Take into consideration what else is going on. Are there major changes going on in the person's life? Are they dealing with a medical issue? We're going to talk more about that later in the presentation, but put it in context. What else might be going on? Next. Learn about the signs, the 10 signs that we just talked about, and the benefits of early diagnosis, so you are informed. Next step. Has anyone else noticed the changes? Depending upon who this is, it may be hard for you to be objective. Bring in someone else who interacts with this person and ask, has anybody else noticed the changes? Next. And then have conversation. Next. Who should have the conversation to discuss concerns? Sometimes it's not the message, but the messenger. And a parent, for instance, might be resistant to their adult children mentioning something for fear that they want to take over and manage their life. So it's important to discuss who should have the conversation to discuss the concerns. Next. What is the best time and place to have the conversation? You want to make sure that you have the person's full attention. They're not rushing out the door to do something. If you know somebody is at their best in the morning as opposed to evening, set yourself up for success. So think about what is the best time and place to have the conversation. Next. What will you or the person having the conversation say? So it's like keeping track of the behaviors you've noticed. You want to be specific. Give yourself, a head start. Write it down. Plan what you want to say. Next. Offer to go with the person to the doctor. If they'll agree, if they will agree, offer to go with them. Next. If needed, be ready to have multiple conversations. You may encounter resistance at the outset. So you need to be patient. You need to really have conviction that this is important. You're worried enough that you need to have this conversation, and you may have to have it more than once. Next. And reach out for support. We're going to talk a lot more about that before we end. Nobody can do this alone. You need to be able to reach out for support. Okay, next slide. Turn to the Alzheimer's Association for information and support. All right, I think we can advance it. No? Okay. Yeah, click on that. There you go. Most people address concerns about memory, thinking, or behavior with their primary care physician. This is usually when people notice changes, that's where they're going to start. However, in some cases, the primary care physician will refer the person to see a specialist for further evaluation, and the specialists may include a geriatrician. A geriatrician is a doctor, a physician, but they specialize in the needs and issues of older adults. A neurologist, because dementia is a neurological brain disorder. A neuropsychologist, a psychologist who may deal with behavior, but specialize again in the neurology. A psychiatrist is a medical doctor who's most often brought in for prescribing medications. And a psychologist, again, like a social worker, can help the family deal with the emotional issues that come along with this. Let's see, I think you got to go back to the previous step to get out of this slide. Next step. We did that. Go to the X above. See if that gets you out of the screen. Do you see that? There you go. Okay, and now down to next. Perfect, thank you. What are the benefits of early detection?
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
All right, so here's a recap about the importance of early detection. Pay attention to any changes in memory, thinking, or behavior that you notice in people. If you see changes that are unusual for the person, remember Teresa, who kept a meticulous house and then suddenly let mail pile up and didn't put her clothes away. If you see changes that are unusual for the person, take action by having a conversation. Discussing these types of concerns can be difficult. Consider using the 10 steps to approach memory concerns as a guide. There are a number of benefits to early detection, including the opportunity to plan for the future, access treatments for symptoms, and participate in clinical trials. All right, next slide. Seeking a diagnosis. Let's test your knowledge. Next slide. True or false? There is currently no way to diagnose Alzheimer's disease. That is false. There are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's with a high degree of certainty. Next. Some of the possible assessments and tests that Mary Garcia may undergo. A medical history, want to see if there's anything else going on medically, a physical exam, maybe screening for depression. Maybe you interview a close companion, and the tests may include laboratory tests, mental cognitive status tests, and maybe brain imaging. Next. Do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? Next. Appointments have been going well. Mom's handling them okay. Think it's really dementia? Guess we won't know until we get a diagnosis, but let's ask Dr. Soloway if it could possibly be anything else.
One could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
All right, here's a recap about seeking a diagnosis. The diagnostic experience may vary from person to person. Something other than Alzheimer's or another dementia could be causing the symptoms. Stigma and misconceptions about the disease, like believing nothing can be done, can prevent some people from seeking a diagnosis. So what's next when the diagnosis is Alzheimer's? Next. I called but got your voicemail. How'd it go? Call you later when I get home, but the diagnosis is early stage Alzheimer's. Oh no. What do we do now? Doc said the Alzheimer's Association offers free resources. Some even help people live well with the disease. We'll call you soon, but left the office with some hope. Next. All right, so this last segment, we're going to talk about the Alzheimer's Association. Next. The mission of the Alzheimer's Association. The Alzheimer's Association is the leading voluntary health organization in Alzheimer's care, support, and research. Our mission is to eliminate Alzheimer's disease through the advancement of research, to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. Our vision is a world without Alzheimer's disease. Next. We're available wherever and whenever you need reliable information and support. So please click on the first one for the helpline.
I've had a couple of phone calls that I've been able to make in to the call center. When I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
And online, yeah, click on that.
I went to the Alzheimer's Association website, which is alz.org. There, I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help? What do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And last, in communities nationwide.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
Next. And ways to join the fight. So let's take a look at some ways. Click on volunteer, please. Whether you can spare a few hours a week or make a more significant time commitment, consider volunteering with the Alzheimer's Association. Numerous opportunities are available, including becoming a community educator, which is what I'm doing right now, or joining your local walk planning committee. Okay, advocacy. Become an Alzheimer's Association advocate and speak out on behalf of the needs and rights of those facing Alzheimer's disease. Trial match. Everyone can help advance Alzheimer's research by participating in clinical trials. You can get started with Alzheimer's Association Trial Match. It's a free, easy to use clinical studies matching service. And I would just like to point out that research needs both people with the illness and people who don't as a control group. So there are ways to get involved in clinical trials, even if you don't have any symptoms of cognitive change. And then the walk to end Alzheimer's. Held annually in more than 600 communities, the Alzheimer's Association Walk to End Alzheimer's is the world's largest fundraiser to fight the disease. Register today to raise awareness and funds to benefit Alzheimer's care, support, and research. And next. And that takes us to questions.
Hi, Janie. Thank you so much for that presentation. I do have a couple of questions. They're just general questions that are on here, and hopefully you can cover that for us. So I'll start with the first one. Do these warning signs apply to Alzheimer's or all forms of dementia?
Really good question. They can overlap. As I think it was one of the experts or Dr. Soloway said in the video, vascular dementia is the second most common form, and that refers to usually people who've had strokes. So dementia, remember, is an umbrella term. It refers to symptoms. So it refers to cognitive changes, symptoms, memory loss, disorientation, confusion, that sort of thing. Alzheimer's disease is the most common form of dementia, followed by vascular dementia, and the other ones, you can read about them, but there are definitely similarities, mostly in word finding, confusion, disorientation.
Great, thank you. And so how are people diagnosed with Alzheimer's?
You start off with a regular checkup because, again, there are so many medical issues that are treatable that can mimic. So I said at the beginning, what you're really concerned about are patterns of behavior over time. Think of Teresa in the video, someone who kept her home in a meticulous way. So now she's older, and over time, she's not picking up her clothes, the mail is piling up. That's not having a bad day occasionally. That's a pattern of behavior over time, and it starts to interfere with her ability to live independently. So you want to start with a doctor's appointment to see if there's anything else, maybe a chronic illness like high blood pressure, high cholesterol, diabetes that's either undiagnosed or not diagnosed at all, so it's not managed, that if that's treated, you might start to see the person's thinking clear up. I think the average person knows how they feel when they haven't slept well or they've got a cold and you just feel sort of sluggish and your brain feels a little fuzzy, like you just can't think clearly. Well, you want to keep in mind, as people get older, age is the most significant risk factor for developing dementia and Alzheimer's. So if you have an older person, you want to get them to the doctor, make sure they get a blood panel, urinalysis. Is anything metabolically out of balance that could be treated? Maybe they have a urinary tract infection, something like that. Let's say you rule out anything else that can be causing it. The next step is typically a referral to a specialist, usually a neurologist. They're going to do a number of tests, both drawing tests, asking questions. And if that still produces significant concern, usually they are sent for brain imaging. Because one of the things the doctors were talking about was when Alzheimer's takes hold of the brain, you have shrinkage, and that will show up on PET scans and different brain imaging. So go to the doctor, referred to a specialist, imaging.
Great. So you basically covered one of the questions, which is what is brain imaging? So thank you for that. And then this is a common question that people have. Is Alzheimer's hereditary?
There can be a hereditary factor, but the biggest risk factor is age. So your risk goes up after age 65. At age 85, approximately 1/3 of people age 85 and older have some form of dementia. So again, things change over time for everybody, but 1 out of 3 when you get to age 85. So that's a bigger risk. Untreated chronic illnesses are a bigger risk, but there is a genetic component. So if you have a first-degree relative, a parent, a sibling that has Alzheimer's, you may be more predisposed. It doesn't mean you will develop symptoms and have the disease, but you're at a greater risk. So minimally, yes, it can be hereditary.
Thank you. That's why it's very important to know the signs. So thank you for that. And then my last question I have here, or give me 1 second. I have 1 second, let me see their questions. Okay, so I have a question here. It says, how close are we to finding a cure for Alzheimer's?
Not close enough, but we're making progress. So this may be, the person may be asking because of what's been in the news recently. This is the first FDA-approved drug in more than 20 years to treat Alzheimer's.
Wow.
The drugs that are available do not prevent, they don't treat in the way that if somebody has Alzheimer's, it's going to actually change the pathology in the brain, and they don't cure. They can treat symptoms, and the earlier you get started, the more effective they can be. I'm going to put in a personal plug that a healthy lifestyle is probably one of the best treatments that you can get. The drug that was just approved has been shown to decrease the amount of plaques and tangles. That on brain imaging is the hallmark that you're going to see that we identify as Alzheimer's disease. These plaques and tangles literally strangle the nerve cells, so they can't communicate. So right now, you and I, Clarissa, are having this conversation. We're not consciously thinking about it. We got all these billion neurons doing their job, fortunately. When you have the plaques and tangles, it kills the brain cells, and that's how the brain shrinks, and that's what we'll see. The new drug that was approved in some people eliminated or decreased the amount of plaques and tangles. Unfortunately, it does not always translate into a decrease in symptoms. So that's why there's some hesitancy, and it took this drug a long time, but because there hasn't been anything approved in more than 20 years, the thought was, let's get this out there. It's also a very expensive drug. So If you are a person or a family dealing with Alzheimer's, talk to your doctor. Find out, is this right for you? But we're also hoping that with more than 150 other entities in clinical trials, that this is going to open up more in the future in the way of prevention and treatment.
That's understandable. And, you know, this disease is very difficult to live with, not only as a patient, but for the family and the caregivers themselves. So, you know, hopefully we're able to continue to promote these signs so that people are aware of it and have more attention to Alzheimer's and dementia awareness. Well, those are all the questions I have for tonight. Let me see if I have any more. I see nothing else here on the chat. Well, thank you so much, Janie. We really appreciate the great information that you provided tonight. And I want to remind everyone watching this presentation that, once again, if you have any questions or would like to learn more about Alzheimer's or dementia, you can visit the Alzheimers Association website at alz.org. Or you can call their helpline at 800-272-3900. That's 800-272-3900. If you would like to see the recordings of this webinar, again, you may visit the Assembly Member Anthony Rendon's social media pages, and they'll be living on the social media pages. You can also visit his website, speaker.asmdc.org. Once again, to find these recordings. Thank you, Jamie, so much for tonight, and thank you, audience, for joining us, and I wish you a good night.